Well, according to a recent heart health survey by the Cleveland Clinic, fully half of Americans have tried a diet in the past year to potentially improve their heart health, but chose the wrong one. And among individuals who either have heart disease or have family members with heart disease, the number jumps to 68%. So there's a lot of confusion out there. Helping us sort out fact from fiction today is Dr. Stephen Nissen, MD, and the chairman of cardiovascular medicine at the Cleveland Clinic. Good morning, doctor.
Good morning.
So help us out here. According to your recent heart health survey by the Cleveland Clinic, men are actually less likely than women to change their diet due to personal experience with heart disease. Why is that?
Well, with regard to diet, I think women are more body conscious. I think that their appearance is maybe more important to them, and so they're much more likely to try to diet, particularly to lose weight. And I think men are more complacent about it, and this is really a difference between the two sexes in their interest and willingness to make these kinds of changes.
And as evidence from the survey, what really seems to be happening is that Americans are completely confused about what constitutes a heart-healthy diet. Can you talk to us about that?
Well, it's understandable that people are confused. They've been bombarded with all kinds of information, low fat, low carb. There are really a zillion diets out there, and almost none of them have any scientific evidence around them. The one diet that does have some good scientific evidence is the Mediterranean diet. This is a diet that is not low fat, it's not low carb, it's sort of a balanced diet, the kind of diet that people around the Mediterranean Ocean eat, high in fruits and vegetables, lots more fish, and lots of olive oil. And it turns out that in a very large study, this diet enriched in olive oil actually reduced the risk of developing heart disease by about 30%.
Well, for those of us cooking with olive oil, that's great news. So let's talk exercise. How much and what type of exercise is actually recommended to reduce the risk of heart disease?
It doesn't matter so much what type of exercise, but what matters is that you actually do it. At least 20 minutes 3 times a week is the absolute bare minimum. If you can exercise every day, get your heart rate up a little bit, maybe break a little bit of a sweat, you're going to be better off for it. You can cycle, you can walk, you can run, you can swim, and the more you do, the healthier you will be. So that if you can get 30 to 40 minutes every day and do that on a regular basis, you're going to reduce your risk of heart disease, you're going to reduce your risk of death, and you actually can even improve brain function.
Outstanding. So these are a little bit more complicated for the average American, but why is blood pressure and cholesterol as important to monitor as our weight and waist size?
Well, blood pressure and high cholesterol are the two most important drivers of heart disease, along with, of course, genetics, family history. And they're both controllable. That's the good news. If you have high blood pressure, we have medications for that, and we can also reduce the amount of salt in the diet, which helps to lower the blood pressure. If you have high cholesterol, you can lower it a little bit with diet. You can lower it a lot with medications. But if you don't know your blood pressure and you don't know your cholesterol, then you can't treat it. And so knowing those numbers is a critical factor in heart health. Everybody needs to know their blood pressure, and everybody needs to know their LDL cholesterol. That's the bad cholesterol that drives heart disease.
Such great information, doctor. Where can our viewers go for more information?
We've set up a website. It's cle.clinic/loveyourheart. If you go to that website, you'll find lots of additional information.
Thanks so much, doctor.
Thank you.